I'm John Strum, and this is Real Talk MS. It's October 12th, and we have a lot to talk about. And I want to begin this week's episode by saying thank you. A couple of days ago, I discovered that out of the 2,696,925 podcasts that are available today, Real Talk MS is in the top 1.5% in terms of global popularity. And that unbelievable accomplishment is all because of you. From the day I first launched this podcast, I've always envisioned it as a conversation rather than a monologue. And to help facilitate that conversation, I've tried to make it as easy as possible for us to connect. So if you have feedback, a question, a suggestion for future podcast episodes, or pretty much anything else on your mind, I hope you'll get in touch. You can use the Contact Us page on our website at realtalkms.com. You can email me directly at John, that's Jon, at realtalkms.com. Or you can call our listener hotline at area code 310-526-2283. So please consider this your personal invitation to join the Real Talk MS conversation. The conversation we're having today is about stem cell therapy for MS. Specifically, it's about a particular stem cell therapy called autologous hematopoietic stem cell transplantation, or aHSCT for short. And it's a very timely conversation, as the National MS Society has just dedicated a whole section of their website to aHSCT. You can visit nationalmssociety.org/aHSCT and learn more about what happens during this treatment, whether this is a therapy that might be right for you, and how to find an aHSCT treatment center that's been accredited by the Foundation for Accreditation of Cellular Therapy. We've actually talked a lot about autologous hematopoietic stem cell transplantation in past episodes of the podcast, and judging from your feedback, I know it's a subject that a lot of you have a keen interest in. Frankly, that keen interest seems to be shared throughout the entire MS community, and I guess because it is, there's an awful lot of misinformation about stem cell therapy that gets posted and then echoed repeatedly in social media. And there are a lot of so-called stem cell clinics that claim to perform treatments that don't actually work, sometimes can even be fatal, and the operators of these clinics, the con artists who are out to rob well-intentioned people who are desperately searching for a cure that doesn't yet exist, these criminals are very good at what they do. Their websites are professional looking. Some boast that they're involved in clinical trials, and they even direct you to visit the clinicaltrials.gov website to check out their legitimacy. Of course, they don't tell you that your own grandmother can register a clinical trial at clinicaltrials.gov. The difference is that these so-called stem cell clinics never seem to report any data from their fake clinical trials. So I guess the point I want to make is that getting reliable, credible, honest information about stem cell therapy for MS is really important as you inform yourself about this treatment. So I want to urge you to visit nationalmssociety.org/aHSCT and make it your starting point for educating yourself about autologous hematopoietic stem cell therapy. I also hope that you'll include this podcast as another source of credible and reliable information. And to that point, we're going to be discussing aHSCT with my guest today, Dr. Jeffrey Cohen. Dr. Cohen is the director of the Cleveland Clinic's Mellen Center for Multiple Sclerosis Treatment and Research, and he also heads the Cleveland Clinic's Experimental Therapeutics Program. And Dr. Cohen is currently an investigator in Beat MS, which is a phase 3 clinical trial comparing hematopoietic stem cell transplantation to high-efficacy disease-modifying therapies, including Tysabri, Lemtrada, Ocrevus, Mavenclad, Kesimpta, and rituximab. But before we get to my conversation with Dr. Jeffrey Cohen, there are a few other things that you should know about. I want to give you a quick update on something we were talking about in last week's episode of Real Talk MS. You might remember that Dr. Anthony Trabolsi joined us with an update on the results of the Phase 2 clinical trial for tolebrutinib. And I mentioned that tolebrutinib was one of a new category of MS disease-modifying therapies called BTK inhibitors. Well, this past week, EMD Serono announced that they had completed recruiting participants for the Phase 3 clinical trials for evobrutinib, which is another BTK inhibitor. BTK inhibitors work by targeting B cells in the immune system, but unlike the B-cell depleting therapies that are available today, BTK inhibitors don't destroy B cells. They merely tone them down, and in MS that seems to limit their ability to damage the central nervous system. The upside here is that your immune system remains intact, so it can still protect you from infection. We've certainly talked about recent research that's shown that because B-cell depleting therapies destroy B cells, they also may limit the immune response to things like the COVID-19 vaccine. So if a disease-modifying therapy can limit the damage that B cells can do while preserving their immune response, it could be a very good thing. So we can look forward to hearing more about BTK inhibitors as this potential therapy makes its way through clinical trials. You might also remember that Dr. Abby Hughes joined me last week to discuss managing sleep disorders in MS. Well, just a couple of days ago, Dr. Hughes emailed me to let me know that Johns Hopkins is now conducting a study to test whether an online program called iSleep-MS can help people living with MS improve their sleep. This entire 12-week study is being conducted online, which means that you can participate from anywhere in the United States as long as you have a reliable internet connection. If you'd like to check out the study and see if you qualify as a participant, you can complete the online screening form, which should only take about 5 minutes of your time. You can find the screening form at tinyurl.com/iSleepMS, and you'll also find that link in today's show notes. You can file what I'm about to say under Things I Never Thought I'd Say on the podcast, but it would appear that the National MS Society is now part of the Marvel Universe. Last month, I told you that Darkhawk, a Marvel superhero from the 90s, had been relaunched, and in this new iteration of Darkhawk, we meet 17-year-old basketball sensation Connor Young, whose entire world changes when he's diagnosed with MS. The Connor Young Darkhawk story is being told in a 5-part series written by Kyle Higgins, and Kyle is including an interview with someone from the MS community in each issue. Well, issue number 2 is available now, and it features an interview with Tim Cutsey, the National MS Society's Chief Advocacy, Services, and Science Officer. So thank you, Kyle Higgins and Marvel Comics, for increasing awareness about MS in a really creative way. And Tim, from one geek to another, I salute you for making your way into the Marvel Universe. I am already thinking about the actors who might portray you in an upcoming movie. I'm very fortunate to be able to connect you with the real-world superheroes, the men and women who are moving the ball down the field when it comes to advancing MS research. In a moment, we'll take a deep dive into stem cell therapy for MS with the director of the Cleveland Clinic's Mellen Center for Multiple Sclerosis Treatment and Research, Dr. Jeffrey Cohen. You don't have to spend much time in an MS group on social media before coming across the subject of stem cell therapy. It's a hot topic because for decades, a popularly held myth about stem cells has been that they're somewhere close to the equivalent of magic. They have the power to cure anything. But like a lot of what we come across on social media, just because an idea is popular doesn't necessarily mean it's true. While there's innovative research being done and real progress being made in understanding how different types of stem cells can be beneficial in treating MS, scientists are learning that stem cells, like any other medical treatment, have their own risks, their own limitations, and like so many other medical treatments, they aren't necessarily the best solution for everyone. Joining me today for some real talk about stem cell therapy for MS is the director of the Cleveland Clinic's Mellen Center for Multiple Sclerosis Treatment and Research, Dr. Jeffrey Cohen. Dr. Cohen also heads the Cleveland Clinic's Experimental Therapeutics program, where he's been involved in a large number of clinical trials, many of which have led to new therapies for multiple sclerosis. Welcome back to the podcast, Dr. Cohen.
Thanks for the invitation, John.
I think that the first step in trying to understand science is to make sure we have our definitions in order. So can you explain to us what stem cells actually are? What kinds of properties define a stem cell, and where do we find them?
So stem cells are defined by several different properties. One is the ability to divide, to replenish their own population. Secondly, to develop into more specialized cells. And third, to create tissues in the body. And so the prototypic stem cell are the cells that make up the earliest stages of the embryo. Those are the cells that ultimately give rise to all the tissues of the body as the embryo develops. But we also know that stem cells the stem cells persist in the adult. Most of the tissues of the body have their own specialized stem cells that are whose job it is to repair those tissues if the tissue gets damaged by normal aging and wear and tear, or trauma, or infection, or some other disease process. So medical scientists have long hypothesized that we could utilize those properties of stem cells to treat human conditions.
I have one more request for a definition. Can you explain what stem cell therapy is?
So stem cell therapy, or what's sometimes called cell-based therapy, would be therapies that utilize stem cells to produce benefit. The most obvious way would be the transplantation of stem cells directly to replace the tissue. But I also like to use a more broad definition that also includes other interventions, medications, or and so forth, that work through stem cells. So they stimulate the stem cells within the body to carry out their repair processes.
What types of stem cells are researchers evaluating as potential treatments for MS, and are there any that are showing particular promise?
Well, so there's two broad categories of stem cell therapies that have been pursued in multiple sclerosis. One is repair promoting strategies. So there, a number of different approaches have been tried. One that's been considered has been direct replacement of the so-called oligodendrocyte progenitor cells. Those are the cells that give rise to the myelinating oligodendrocytes, the cells that make myelin. Another approach would be to use another kind of stem cells, so-called mesenchymal stem cells, to deliver soluble factors that support the natural remyelinating stem cells to create, as it were, a more conducive environment for repair. And then the third variation on this would be to use medications and so forth that create that more beneficial environment. So that's one category of stem cells for multiple sclerosis. And then the other general category would be as an immune-directed therapy, as it were, sort of a souped-up disease-modifying therapy. And so an example of that would be hematopoietic stem cell transplant, or what's sometimes known as bone marrow transplant. And so that therapy involves delivering a potent chemotherapy that eliminates the malfunctioning immune system that leads to damage in MS, and then to replace that immune system by giving hematopoietic stem cell transplants with the hope that the newly formed immune system would function more normally.
I know that I said we were done with definitions, but I'm hoping you can help us understand a little bit more about what this hematopoietic stem cell transplantation is all about. How does this procedure work?
Well, first of all, hematopoietic is a mouthful, so that's where I would start. But it's the overall procedure has several steps. One is collection of the hematopoietic stem cells. So they can be collected from the bone marrow, but now more often they're collected out of the blood. So that's the first step. And then the cells are typically frozen. The next step is the so-called conditioning regimen. So that's the potent immune therapy that I talked about. Usually it's high-dose chemotherapy that eliminates the immune system. It also sometimes, as collateral damage, can damage other aspects of the bone marrow. And then that's followed by the transplant itself, where the frozen hematopoietic stem cells are thawed and then readministered to the person with MS. And so the key points are that, first of all, it's a multi-step, complicated procedure. Secondly, that each of the steps can be associated with potential complications. And third, and this is the aspect that's frequently not understood, is that the actual MS therapy part of all of that is the conditioning regimen, the elimination of the immune system and then having it redevelop. And in this case, the transplant can be thought of as the rescue from the therapy to shorten the consequences of the conditioning regimen, to lessen the complications of it.
The National MS Society's National Medical Advisory Committee has developed recommendations for the optimal use of hematopoietic stem cell transplantation. And according to these recommendations, who are the best candidates for this procedure?
So hematopoietic stem cell transplant is an immune therapy. It, as I said, it can be thought of as sort of a souped up version of our disease modifying therapies. So it tends to work in the people that those therapies also work the best in. So people that are most likely to benefit are those that are younger, who have what we call active relapsing multiple sclerosis. So they're continuing to have relapses or active MRIs, and that's occurring despite treatment with at least some of the available therapies. And then conversely, the people that are more likely to or less likely to have benefit and are more likely to have harm from the procedure are people that are older, who have predominantly progressive MS. So they're getting worse gradually, which we think is largely due to neurodegeneration rather than new inflammatory lesions, and who have severe disability that may make them more prone to complications. And finally, who have other medical conditions that make transplant riskier. So we want to, because it's an involved procedure, we want to make sure that it's done in people that are likely to benefit and less likely to have complications.
Well, you mentioned that it is an involved procedure. You mentioned earlier some of the complexities involved. I think a lot of times when somebody thinks about complex procedures, you make some sort of internal logical connection that they're good for dealing with complex conditions. But I heard you pretty clearly. It sounds as though this is not a great option for treating people living with progressive forms of MS.
Right. So I mean, there have been quite a few studies of hematopoietic stem cell transplantation over the years in multiple sclerosis. And it's become fairly evident from those studies that the people with the characteristics that I described are the ones that are more likely to benefit, people with active relapsing MS, and the people that are not likely to benefit, more likely to have harm, are people with severe progressive MS with severe disability and other medical conditions. It's not that we want to withhold the therapy from those people. It's just that we want to make sure we use the right therapy for the right person.
What can you tell us about the safety associated with this procedure? What are some of the potential risks involved?
Well, so first and foremost, there is some risk of death. Now, previously, numbers like 1 to 3% of transplant-related mortality were quoted. Now, the rate's much more like 0.1 or 0.2%, and that's with more experience with the procedure, refinement of the procedure, and importantly, better selection of people to undergo the procedure. But most people undergoing this procedure do have some significant complications, and each of the steps of the procedure can have potential complications. The two steps that are the most risky is the conditioning regimen. There can be direct side effects of the chemotherapy, the ones that most of us would anticipate. So nausea, hair loss, infertility, mucositis, irritation of the lining of the mouth and throat, and so forth, or indirect consequences of the so-called immunoablation and myeloablation. So during the time when the person does not have an immune system, they're prone to infection, not just because of lack of lymphocytes, but also other white blood cells. There can be anemia because of the loss of red blood cells, and there can be bleeding because of impairment with the mechanisms for clotting. And so that's the riskiest part of the procedure, and that's why the procedure is typically done as an inpatient. And then the transplant itself can sometimes have complications, and so that's the other reason why it's typically done as an inpatient, so that the complications from that can be dealt with. But the good news is that once someone recovers from the transplant, the adverse effects are actually quite uncommon after that.
We've talked about who might be considered the right candidate for this therapy. Let's talk about some of the things beyond the side effects that someone might want to consider. For instance, how long is the hospital stay associated with hematopoietic stem cell transplantation?
Yeah, so the length of the inpatient stay depends to some extent on which conditioning regimen is utilized. Some are more intense than others. So generally the hospitalization ranges from several weeks to a month, about a month and a half, depending on the regimen and whether there's any complications. The other considerations are it's an expensive procedure, and frequently it's not paid for by insurance. So someone has to take that into account, and that's oftentimes one of the obstacles to pursuing hematopoietic stem cell transplant is getting coverage for it. And then the other consideration is the quality of the program providing it. And there are a lot of considerations there. You want a program that has expertise in transplant, and also that has access to, if not active collaboration with, people with expertise in multiple sclerosis.
You mentioned cost being a factor, as it is in most things in life. How much does this procedure cost in general terms?
It ranges from around $100,000 to $150,000. So it's very expensive. Now, one of the potential advantages is that those costs are largely upfront. They are associated with the transplant itself. And one of the advantages is that oftentimes very potent control of MS is achieved that lasts for 5, 10, 15, 20 years without the requirement for ongoing disease-modifying therapy. And our disease-modifying therapies in MS themselves are fairly expensive, ranging from $60,000 to $80,000 per year. So potentially within 2 to 3 years after transplant, it becomes cost-effective. It becomes less costly as compared to our disease-modifying therapies. That's one of the reasons why it's being pursued as a potential treatment option.
I remember the earliest days of the web. There was a very famous cartoon of a dog sitting at a desk operating a computer, and he's talking to another dog, and he says, "The great thing about the internet is nobody knows you're a dog." And I bring that up because a lot of people living with MS who are interested in stem cell treatments, who are many of them desperately looking for a cure, have seen and heard about stem cell clinics that claim to cure MS. They have beautiful websites. They charge anywhere from $10,000 and up into six figures for a so-called treatment that doesn't sound anything like the one we've been discussing. In some cases, the whole process takes less than 1 day. Often these places explain that they're going to harvest stem cells from your fat tissue. They process them in a centrifuge or a high-speed mixer, and they re-inject those cells back into your body and send you home. Again, it doesn't closely resemble or even remotely resemble the complex procedure we've been discussing. Is there any evidence to suggest that this sort of treatment is safe and effective in treating MS?
Right. So you bring up an important point. So one is that I'm not sure everybody recognizes that there are many kinds of stem cells. And the stem cell approach that I was describing a few minutes ago is hematopoietic stem cell transplant. There are a few clinics that offer that, and that is something that most university centers can perform. But that's not what most of these commercial clinics are offering. They're offering what they claim to be mesenchymal stem cells, which is a different kind of stem cell. I mentioned it earlier. It's a stem cell that's thought to have immune regulation properties and also repair promoting properties. And that also has been pursued in MS, and it has shown some promise. But one of the things that we've learned from all of those studies is that we don't know how to do that procedure correctly yet. There are lots of very important details that are still unclear, and very, very fundamental details like where do you get the cells, from which person and from what tissue, how many do you inject, how do you inject them, how do you prepare them in culture, what are their potential risks, and so forth. So nobody knows the answer to those questions, and certainly the commercial stem cell clinics don't know the answer. In my view, they are preying upon the gullibility of the public, people that are willing to try almost anything. And at best, it's a waste of money, and at worst, it can be dangerous. So I think people need to be very careful about those claims.
There are other cases of people living with MS visiting countries like Mexico, Costa Rica, Panama, and even Russia to receive stem cell therapy. Is this a good idea?
So there are a couple of international clinics that do have experience in the procedure, and they generally can perform it in a reasonably safe way. But there are some shortcomings. One is that prior to the procedure, at least in my experience, there's very little, if any, communication with the person's neurologist. So at best, they have the transplant facility has very incomplete, potentially inaccurate information about the person that they're planning on performing a transplant. Secondly, in my experience, there's almost no communication after the transplant with the person's treating neurologist. So I have no idea that my patient underwent transplant. I don't know what was done. I don't know what I'm supposed to do to monitor them afterwards. It's as if the patient's given a handout when they're done and told to take that to your neurologist and ask him to do such and such. That's not the best way to manage someone's multiple sclerosis. So I have some concerns about that. I think people should ask themselves, if they have to travel to a foreign country to get a procedure, does that pass the smell test?
That begs the question, how does someone go about finding a safe and reliable place to have this procedure done?
Well, so hematopoietic stem cell transplant, most universities have a transplant program because it's been used to treat cancer and other conditions for quite a long time. And to see where transplant fits into our overall MS treatment repertoire, there are several ongoing formal clinical trials to see how transplant compares to our highest efficacy therapies. And one of those studies is called Beat MS. I'm one of the lead physicians in that study. So one can go to the Beat MS website. It's beat-ms.org. That lists the centers. And I would encourage people to get involved in Beat MS if they're eligible. But all of those centers also have transplant programs in MS because they needed that to be part of the trial. So most of them, like us, are also performing transplant in some people outside of the trial if it seems to be warranted, but for one reason or another, the person can't participate in the trial. So that's where I would recommend people go, because those are programs that we know have expertise in MS and experience and expertise in transplant. Those programs have been very highly vetted. So I think one can trust their expertise.
Well, Dr. Jeffrey Cohen, I want to thank you for all that you do every day to improve the lives of people living with MS. And thanks for talking with me about such an important topic today.
Well, as always, I enjoyed talking to you, John.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/215. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or text. And don't forget to check out my new 8-episode podcast series, The MS Caregiver Conundrum. In this week's episode, we're talking about an important yet often overlooked subject when clinical psychologist Dr. Rosalind Kalb joins me to discuss the emotional burden of caregiving. You'll find the MS Caregiver Conundrum at mscaregiverconundrum.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.